I'm Dr. Amani Jambakar. I'm a surgical oncologist in Santa Fe, New Mexico, and this is a made-up case of a 48-year-old who felt a lump in her breast. She had previously gotten her first mammogram before the pandemic hit, and then she was due for her second mammogram, but couldn't get in because all of the mammography centers were too backed up. And then she felt, maybe I don't really need it because we don't have any family history of breast cancer. She started feeling this lump and she thought it might go away around her cycle, but it persisted. And after it had been there for about 3 weeks, she tried to make an appointment with her PCP. Unfortunately, due to New Mexico's medical malpractice laws, her PCP left the state and they told her the soonest she could get in with someone was 10 months. She was really worried about the lump and needed someone to order a mammogram, so she went to go see her OBGYN instead. And luckily, they were able to get her in within 2 weeks. They ordered a mammogram for her, and this is what it showed: a large lump right under her nipple, exactly where she had been feeling it. And this is what the ultrasound showed. You can see there is a dark hypoechoic mass here with irregular edges. She had a needle biopsy, which showed that this was a 3 centimeter estrogen and progesterone receptor positive tumor, grade 2. She was referred to a medical oncologist who started her on a hormone-blocking pill called letrozole, as well as a CDK4/6 inhibitor called Kisqali, with the intent of shrinking this lump so that way she could ultimately have a lumpectomy, which is what she wanted. After about 2 months, she could feel that the lump was shrinking, and after 4 months, she could barely feel it. And this is what her ultrasound showed after 4 months. She was able to have a lumpectomy as well as a sentinel lymph node biopsy, and the lumpectomy showed that most of the cancer cells were dead and that she had about an 80% response to her treatment, and her lymph nodes were negative. She kept taking the Kisqali for a total of 3 years and the letrozole for a total of 5, and 5 years after that, she's still doing really well and her cancer hasn't come back.